This films, we are going to be looking at a lateral cervical. The first thing we're going to make sure is the patient is standing in the proper position, that is on a landscape position, which means patient should be upright. Your shoulders should be completely relaxed and slightly tilt towards the bucky. Perfect. Your palate, your heart palate should be parallel to the floor. That looks good. Great job. And you're gonna do a slight tilt towards the bucky for me. Okay, that's perfect. And that's a flexion tilt. All right. Now for the central location, it's under C4 and under the angle of the mandible. Film size is about 10 inch to 12 inch. Marker position is under the chin. The SID is about 72 inches. And if you can do a complete exhalation for me. Perfect. Again, that was a lateral cervical. This is an A to P pelvis. First thing we're going to make sure is that patient is standing in a proper position. That is in a landscape position. Patient is standing upright. The patient is going to be touching slightly against the bucky. Next, I'm going to have you internally rotate your feet about 15-degree angle on both sides. Perfect. I'm going to may have you hold the bucky if you need to. Otherwise, everything look really good. I'm going to have you take a deep breath, exhale, and hold. The central ray location is horizontal, about 1.5 inch to 2 inches below the ASIS. The and vertical through the midline of the body. The film size is about 17 inch to 14 inch horizontal. The marker position is on the right. The SID is about 40 inches. And great. On this x-ray, this is an A to P open mouth. Patient's gonna be in the proper position with her head tilt slightly lower to the border. The patient head is going to be perpendicular to the film. All right, we're gonna have A to P rotation, like a lateral flexion. I'm gonna have you open your mouth as wide as possible. And when we find the atlas, I'm going to have you move your teeth out of the way. All right. So the central ray is through the open mouth into the center of the film. The film size is about 10 inch to 12 inch. Patient position or marker position is on the left. The SID is about 40 inches. And I just want you to hold and don't move.